Hello, my name is Ali Ahmed. I'm a professor of medicine in the divisions of geriatrics and cardiology in the Department of Medicine and in the Department of Epidemiology in the School of Public Health at UAB, University of Alabama at Birmingham, and the VA Medical Center. We just presented findings from our study at the late-breaking clinical trial session at the American College of Cardiology. As you know, heart failure is the #1 reason for hospital admission and readmission for older Americans. The new healthcare law requires the Medicare to penalize hospitals if their older heart failure patients return to the hospital within 30 days and if the rate is higher than the national average. If you remember from the Jenks study from 2009, that over a quarter of older hospitalized heart failure patients return to the hospital within 30 days of discharge. And the new healthcare law defines that as unacceptable and started imposing financial penalties for hospitals with higher than average readmissions. So we know that digoxin reduces hospitalization due to heart failure. That's pretty well known from the DEACH trial. So what we are interested in, if the effects of digoxin was early enough to have an impact on 30-day all-cause admission and broad enough to impact all-cause and not just heart failure admission. And we wanted to look at the effects in older adults because the new healthcare law applies to older heart failure patients. What we found is that digoxin had a significant impact on 30-day all-cause hospital admission for older heart failure patients. We also found that the effect of digoxin extended to 60 and 90 days, suggesting that the early benefit was not the expense of later harm. We also found out that the digoxin did not increase mortality. In fact, there was some trend for lower mortality, which was reflected in the effect of digoxin in lowering the all-cause mortality or all-cause hospitalization, suggesting that the early reduction in hospitalization was not at the expense of higher mortality. We also found that the effect of digoxin was pretty homogeneous across a number of clinically significant subgroups, such as women, patients receiving digoxin prior to randomization or not receiving digoxin. And more importantly, what we believe is that the digoxin appeared to be more the effect of digoxin appeared to be more pronounced in sicker heart failure patients, and which makes us hope that as post-discharge, as heart failure patients in the post-discharge setting are sicker because they just came out of a hospitalization from acute decompensation, digoxin would be equally effective in this population. And if we can replicate that in a population such as post-discharge, much sicker heart failure population, older heart failure population, a very inexpensive and old drug will provide a tool for addressing a costly problem for our nation's healthcare system, and along the way will help many older heart failure patients, a rapidly growing population because of aging of a population. Thank you very much.